STRENSIQ, asfotase alfa, indication and important safety information, including boxed warning. Indication. What is STRENSIQ? STRENSIQ is a prescription medicine used to treat people with perinatal, infantile, and juvenile onset hypophosphatasia, HPP. Important safety information. What is the most important information I should know about STRENSIQ? STRENSIQ may cause serious side effects, including severe allergic hypersensitivity reactions. Allergic reactions are common with STRENSIQ treatment and can be severe and life-threatening. Severe allergic reactions have happened in some people within minutes after receiving STRENSIQ and more than 1 year after starting treatment with STRENSIQ. Stop using STRENSIQ and go to the nearest hospital emergency room right away if you or your loved one get any of the following signs and symptoms of a serious allergic reaction: difficulty breathing, choking sensation, swelling of your eyes, lips, or tongue, dizziness, nausea or vomiting, fever, headache, sweating, feeling irritable, chills, skin redness, skin rash or hives, itching or numbness of the tongue, lips, cheeks, or gums.
Growing up, I never expected to be very tall. My mother's 4'9". So when you get to 7th grade and your peers continue to grow and you're still waiting for that growth spurt and it never shows up, that was pretty hard to deal with.
So I would go for long walks when I was a kid, and my feet would hurt so bad that I would be beside myself. My ankles would fall in. So my mom had to get me these really sturdy Oxford shoes that would hold them up.
Quinn was happy, Quinn was a good eater. Quinn seemed like a healthy kid. He started falling behind on gross motor skills. By the time he was a year old, he was not standing, and he should have been starting to walk at that stage.
But when you would say, I have trouble running, they would say, where's your doctor's note? And my doctor would not give me a note because I was undiagnosed, so I would have to do it anyway.
In my senior year cross country year, I seemed to be really prone to injury. But it was just, you're running too much, or you're running with bad shoes, and nobody looked further than that.
I went to the doctor a lot, and I was repeatedly diagnosed with depression.
I'd put on a bit of weight into my early mid-20s, and I had a new family. Every physician I saw from mid-20s until 39 said the same thing. You are overweight, you need to focus on your diet, and you need to focus on exercise.
In my early 40s, I started recognizing that I was feeling even worse than before. I started having a lot of muscle injuries. It just kept getting worse and worse as the years went by, where I couldn't even work full-time anymore.
After he turned a year old and started getting his first teeth, they started falling out almost immediately. When he lost teeth for the second time, we went to a pediatric dentist.
I started reading my own medical records, and I noted that there was something not normal in all of my blood work.
When I was in my early 60s, I went to an endocrinologist. They tested my vitamin B6 and my PEA. They were both high. So with low alkaline phosphatase, high B6, high PEA, I had a diagnosis of hypophosphatasia. Finally.
The pediatric dentist was the first person to suggest metabolic disorder. The metabolic specialist immediately recognized hypophosphatasia.
So I went to another doctor, and it showed, again, a low alkaline phosphatase, but it also showed an elevated B6.
When that word was presented to us, I started thinking of his future in terms of, would he be capable of having meaningful relationships? Would he be able to be independent?
My doctor called me when he got the test back, and he said, you absolutely have a mutation. Let's look at getting you on the treatment for HPP.
After all those years, I finally received my diagnosis, and I felt vindicated and surprisingly happy, which doesn't make a lot of sense, but I knew there was a treatment, and I was excited to try it.
I was optimistic to know that there was treatment available, especially because there was nothing available as far as any treatment for HPP, only addressing some of the symptoms. So this really changed my view of Quinn's future.
What are the other possible side effects of STRENSIQ? STRENSIQ may cause other serious side effects, including skin thickening or pits at the injection site, lipodystrophy. Lipodystrophy is common and has happened after several months in people treated with STRENSIQ. Calcium buildup in the eyes and kidneys. People with HPP are at increased risk for developing calcium buildup in the body. Calcium buildup in the eyes and kidneys has happened and is a common side effect of STRENSIQ. Calcium buildup in the eyes and kidneys may also happen in people with HPP who are not treated with STRENSIQ. Your healthcare provider should check your eyes and kidneys before and during treatment with STRENSIQ. Immune-related effects. You may develop antibodies during treatment that may decrease how well STRENSIQ works. Tell your healthcare provider right away if you get worsening symptoms of HPP, including difficulty breathing, difficulty walking, feeling tired, bone pain, stiff joints, or loss of appetite. The most common side effects of STRENSIQ include local skin injection site reactions such as skin redness, bruising, color change, pain, itching, hardening of the skin, induration, swelling, and bumps. These are not all the possible side effects of STRENSIQ. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You will begin receiving STRENSIQ under the supervision of a healthcare provider. Tell your healthcare provider about all your medical conditions, including if you have had an allergic reaction to STRENSIQ, are pregnant or plan to become pregnant. It is not known if STRENSIQ will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if STRENSIQ passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you use STRENSIQ. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. There is a registry for people who use STRENSIQ. The purpose of this registry is to collect information about HPP and about what happens when you use STRENSIQ for a long time. For more information about this registry, talk with your healthcare provider or go to www.hppregistry.com. To report suspected side effects, contact Alexion Pharmaceuticals, Inc. at 1-844-259-6783 or FDA at 1-800-FDA-1088 or www.fda.gov/MedWatch. Please see full prescribing information and patient information for STRENSIQ, asfotase alfa, including boxed warning regarding severe allergic hypersensitivity reactions at strensiq.com.